So our goal when we're talking about diagnosis coding, because this is part of it, what we saw on that initial visit, right? We need the history of what's going on, the exam, we need some diagnosis. What you're going to want to do is kind of go through this process for each area of complaint. What is the history and the details? What are any complicating factors with that? What's the exam based on what you found out? And then how do we arrive at our final working diagnosis? We probably are weeding some things out along the way, right? And then we arrive at our final diagnosis, and that should line up with everything else that's documented, the complaint, the exam findings, and then lead to the treatment that we want to give the patient. For Medicare, we want to have for each area of complaint a coupling of diagnosis. We want to have the primary segmental somatic dysfunction and then the secondary neuromusculoskeletal diagnosis or neuromusculoskeletal condition. That's important to submit those way for Medicare. For other payers, you want to just follow their payer guidelines. They're all just a little bit different.